We're back with Dr. Flores. You should remember him, guys. Short-term memory. If you have memory problems, you need to see a different type of doctor. Dr. Flores, doctorate of chiropractics, right?
Yes, sir.
There you go. I need to get you more on the screen. All right. So today we're talking about another common pain, woe, injury, the lower back. Lower back pains are a common phenomenon, wouldn't you think?
Oh, yeah.
You see it quite a bit?
Oh, that's my
I can't be the only one with it?
That's my bread and butter, 100%.
Okay. What are some of the main, when people come to you, things that you kind of see? How do you even kind of assess for it? Do you look for movement flaws? Do you look for a specific instance, like I did this and it hurt, or is it like a progressive over time thing? How's it work?
That's a really, really good question, Andy. What happens is we have acute injuries and chronic injuries. If I have a patient that comes in and say, "Doc, I just did this, pain came from that," well, that's a really good indicator of what happened.
Okay.
Some patients will come in, or some clients, they'll come in and they'll say, "Doc, this has been going on for 6 years or 20 years. And then that's when it's a little bit different. The most common injury that comes into my office is lumbar sprain strain. Okay. A sprain is anytime you get a ligament that is actually extended further than it should be. There might be some minor tears and it inflames.
Okay.
Strain is when you have an overload of the muscle. It may acutely be explosive and work too hard and spasm, or chronic overuse of that muscle. That's primarily the number one thing that comes in my office. And the reason why is because we sit all day. We have the worst posture in the world. That's us. But
ergonomic, worst posture.
Very, very important. But the number one, and then also comes with that is for athletes, very simple, like I talked about in the shoulder stuff, is the form's not good. They're lifting too much weight.
Yeah.
Okay. Or they're doing it way too much. Those are the main things. Athletes have adrenaline. They push themselves, but like you said, at what cost?
Well, and I can tell you too, because we see it in the gym. Well, I think it's a bigger problem here because we don't stress the competitive nature of what can happen even when you're working out next to somebody.
Sure.
You're naturally going to kind of want to keep up with it, right?
Sure.
That's ego, which we kind of set an outcome-based goal for your workout. You're now looking at maybe running into something because now you're going to find a way to get it done. You will find a way to move the load, to push yourself faster, and when you do that, that's where it comes at expense of your form, right? So when we talk about here's the correct way to do things, and then people go into a workout, especially if something's time-based, which is why we don't do a lot of time-based workouts here, they will always find a way to get the work done, which is that killer drive mentality, which is a great thing to have when you can kind of peg it with getting your ego aside, I know I'm not doing this well, or when the coach has corrected you 2-3 times and so you dial back off of that. You're no longer in that rat race. What about, tell me a little bit about the SI joint. I guess it can get a little mobile, it can be off, it can be, what?
Yeah, some people, naturally, they may be born a certain way, and they may have a shorter leg than the other. No one's 100% symmetrical, I tell everyone.
Yeah.
Or number two is, what actually happens is that muscles in the glutes, or the low back, or the hamstrings, what happens with that is they may be more tight than the other one. So let's say the right side may be a little bit more tighter, so therefore that side may kind of go up just a little bit more because it's contracted more. So now you're not walking even, okay? That's one thing that I see.
So when you do a squat test and you see somebody really kind of favor off to a side, things like that on their deadlift, they'll have that little sway over.
Shimmy, yeah.
Those are kind of telltale indicators of a side's more dominant.
Yeah,
Okay.
And the reason why is because the majority of the times what happens with SI, I guess hypomobility or not moving well, is one side may be taking all the weight, because there are times squatting, you'll see someone slightly come to the right or go to the left, and then the other side doesn't move. So it has no reason to move. And then what happens with that is when the SI joint gets locked up, other joints have to make up for it, the low back.
Yeah.
Because when the hips don't move, low back becomes extremely mobile to make up for it. And then you have other types of issues that stem from that.
So it kind of goes right back to that whole compensation that your body, just because your body can't do something correctly, it'll still get the job done, right?
Yeah,
You said, if you have the task, you'll get it done, but taxing something. All right, so let's go find out a couple of things that could help alleviate the pain, and maybe like a few more assessing tips.
I tell patients to lie on your side, and with that, very simple, I say I want you to take the leg that is closest towards the ceiling to touch the floor. From here, take the opposite hand, and what I want you to do is just bring it to the other side. And you can see that there's still some space between here and the ground. I tell them just breathe in and breathe out. And then when you do that, it'll slowly lengthen the muscle. Notice, I'm sure, and touch the floor. Or just go as far as you can. What happens with that is you start to stretch the lumbar paraspinals and the multifidi. And you can do that both ways. It's always good to stay balanced. So from this side, very simple. Go to the other side, you can see that this side is much more tight. And then what you do is you just breathe in, you let it all out. The most common way that I see people do it, and even the way that I recommend my patients, is to use a foam roller. And what I want you to do is put one foot flat on the floor, another hand right here, and I want you to kind of not go straight up, not go straight to the side, but kind of go as a diagonal. And what you do is very simple. You just kind of glide over that trigger point so you can release it. The looser you are, the better that's going to happen. If you find a point that's really tender, just stay there for about 5 to 10 seconds until you feel it kind of melt away or release. If you happen to have a trigger point that isn't going away, very, very simple. If you happen to have anything, switch from a foam roller. This is a lacrosse ball. I use a golf ball depending on how tough you are. And what you can do is very simple. You can do the same thing. You can kind of, first you're going to have to find it. That's really tender. And what's going to happen is you're just going to kind of glide on it until you find that point. And this is a little bit more tender, so you don't have to go fast, okay? What you want to do is just go nice and easy and just kind of just go a few passes. Do it maybe for about 30 seconds to 45 seconds. And the last one that I always tell people for stretching the glutes, specifically for piriformis, is to lay on your back, put your leg in a figure 4 position, and what you can do is you can even go through your legs, the outside, grab the front portion of your knee, the opposite leg, and stretch it, pull it slowly towards you. You're going to feel a really strong stretch on the outside. And what I'm going to do is I'm going to just kind of hold it for a second. I always tell people, put their head flat on the floor. You start doing this, you're going to start to engage your abs and your back. The whole point is just relax, because you want to isolate that muscle. You hold that for about 30 seconds to a minute or whatnot, then switch sides. One side will always be tighter than the other, and just repeat.